Hello everybody, Dr. John here and welcome to this product review. Now the product that we're going to be reviewing today is the Underdog Orthopedic Bed system. And this is a novel system that works off dry flotation technology. And you might be saying, what's dry flotation technology? And this is an air mattress system that mimics the realities or the fluidness of water and is incorporated into a bedding system for your pet. But before we get into that, I need to talk through a disclaimer. The bedding systems, as you're going to be seeing, have been with me now the last 3 to 4 months, and they were sent to me very graciously from the company to review. Since then, I've been so impressed with the system that we've incorporated them into our store as affiliates. So that kind of gives you an idea of where this review is going. And so I just want to get that out front. There is a disclaimer that I did not purchase these bedding systems to try. They were donated, and over the last 3 to 4 months, we've put them through their ringers. But enough of that. Let's go on and talk about what this bedding system is, but also what the philosophy of use for this new technology is. So here is a diagrammatic representation on how the dry flotation technology works within this bed. And so you have these individual air cells that are all connected to the air cells around it. So you get, as they call or they phrase, the water flow system through this air mattress technology. So as we push down or your pet's joint compresses one of these air cells, the other air cells around it are lifted up. And this gives the support to the surrounding structures of that joint, and that's where the really cool and exciting part of this technology is incorporated into this bed. But also we always talk about, and you'll hear me refer to all the way through this presentation, the 6 degrees of movement. And so I want you to look at these diagrams because this is a great representation about what the 6 degrees of movement are. And I like to point and think about them as like my fingers on my hand, and they can move back and forth sideways, they can twist, and they can go up and down to do everything they need to support the joint and give the support that is needed to the joint and the surrounding structures. When we think of a traditional foam mattress or just a blanket or a rug, there's no movement. It's either down or up, compress or uncompress. There's no movement where we can then get a low friction in that area to help support the joint. And so this is the real power of this, is it creates a low friction area that can move individually within a couple of inches around and create that individual supportive environment anywhere on the bed to support different parts of your pet's biomechanical structure. So the joints, the hips, the shoulders, the trunk, different areas need different levels of support, and this incredible ingenious system allows that. So how does the system work? And really there are 4 main areas to how it works. The low surface tension. So weight can be evenly distributed across the entire bed for maximum comfort. We have constant reinforcing forces, and you might ask, what's that? And that is, and we'll show you some force plate data in a minute, but allows that the pressure points or the high load areas of the joints are supported in this bedding system. We've just talked about the 6 degrees of freedom or 6 degrees of movement, and then the real minute or the real subtlety of this bedding system is there's low friction and shear forces. So things are smooth. Because of the 6 degrees of movement, those joints can move from one air cell to the other very easily. When we compare them to a foam or a other bedding or hard bedding system, we don't have that movement. So when that joint is being compressed on that spot, it is being compressed. So if we think and we take our elbow and we push down on our hand or push down on our desk or limb, there's no movement. But when you experience this bedding system, and I like to say it's like nothing I have ever experienced before, there is movement when you compress and push down on an area. It moves and it's being supported like it is in water. And that's where this low friction shear coefficient is so important to this system. So here's a force place analysis, and I'll explain what you're looking at. So on the left-hand side, this is the Underdog bed system, and low areas of compression or force are blue. And as we go through the spectrum, yellows and greens are more force, and then it goes oranges to reds for a lot of force. So if we look at the left-hand side, there's only blues, greens and slight yellows. On the right hand side, this is a image of another manufacturer's mattress, and this is a foam mattress, and we can then see there's more compressive force areas. So we now have reds and oranges where there's compressive force compared to the same joint on the Underdog bedding system that you see there are not those point load stress areas as you see with a traditional dog bed. And this is a little bit more easy to visualize and understand when you look at then when they compared point or force place analysis to a wooden floor, a memory foam mattress, and then the Underdog bedding system on the bottom. And so once again on the wooden floors, you can see those areas of red when it comes to the sternum and the elbows in the example of the golden retriever. And then when we go down to the memory foam, you can see there for on the elbows and still on the sternum, areas and point sources in the red, but we have more blue. So we all know that the memory foam or any type of padding is going to be better than a hard wooden floor. But now when we go down and we look at the bottom example, the Underdog bed, we see there's no point loads. There's no red and orange areas over the elbows or in the sternum area. Everything is well distributed, and we now have an even distribution of weight and support in this bedding system. So you might be asking yourself, why is this technology important for my dog? And what does it mean when they're pushing down on their elbows or their hips and for the comfort level? And so here's my big boy, and so he's about 100 pounds. And when you look at your dog sitting on the dog bed, traditionally they have their elbows underneath them, their hips are on one side, so all that pressure, if they have hip dysplasia, is down being put onto this rear hip joint. But if they have elbow dysplasia, that force is being transmitted straight through. And the beauty of this bed is it's distributing the air flow in this system so that all the joints are supported. So if I'm pushing down here, I can feel that there is no connection between his elbows and the floor. There is a cushion underneath, and that's what we want. And that's the beauty of this dry flotation technology at protecting their joints. And we'll look at more detail the actual material and the covering of the bedding system, but the material, I like to say, it's like a thick denim suede. It's like a microfiber is the only way I can describe the suppleness, but also the quality of the thickness of the material that's used to cover the bedding system. But the material is water resistant. It's stain and odor resistant. It also has an antimicrobial factor into it that's really important. We'll talk about that later on. It's machine washable and durable. And you'll see we'll put it through all its tests, put it through the ringer as we go camping with it for 2 weeks. But enough of that, we'll be touching on that later on. But the actual covering of the bedding material is a lot of thought and effort has gone into to make a very durable cover. So when we talk about philosophy of use, let's take a step back, because my philosophy of use now for multimodal approach to a pet or a patient throughout their lifetime has changed after I've researched this type of technology. Because traditionally we've got it all backwards when it comes to bedding systems. We think about we'll just give them a bed through their life, and at the end of their life we give them a really good bedding system to help protect their joints and make them feel more comfortable. And this is the wrong way we should be thinking about our pets and preventative medicine or preventative modalities for degenerative joint disease. We should be flipping this on the head and incorporating a really supportive bedding system all through their life to slow down the process of degenerative joint disease. And so now that we have this new technology, dry flotation technology, to mimic water in a bedding air mattress, we've really changed how we need to think about preventing degenerative joint disease from developing in our pets throughout their lives. And so this is what I'm really excited about this technology, is now we have a way to incorporate a new really cool technology into a system that can help slow down and prevent the development of degenerative joint disease in our pets or our patients. So I've created these slides to walk us through how we can incorporate this bedding system into a multimodal treatment plan for your pet. So let's talk about uses of the bedding system. And so I like to break this system down into two areas: in-clinic uses and out-of-clinic uses, or at-home use. So let's talk about and quickly just look at what this system can be in clinic use. And this system is incredibly great at animal recovery after surgery. And that's where I first was exposed to this bedding system. They were using it to recover orthopedic surgery cases on the mat system. And I was like, wow, what is this? And then I investigated more and I said, this is an incredible piece of technology. But when we're thinking also our clinics or rehab facilities for neurological bedding, this is really important because traditionally we'd use human grade memory foam that would have neurological patients, degenerative myelopathy patients, spinal injury, invertebral disc disease, just to name a few. Traditionally, we would lay them on a human grade memory foam so they're all supported while we do our rehabilitation or treatment modalities on them. I find this system even better because, as we talked about the 6 degrees of movement, we have support here, but also because it is a rubber encapsulated system, if they have an accident, if there is any leakage of any type of fluids like bladder or they defecate, it's very easy to clean and keep this system hygienic for the next client. Also, I've encouraged veterinary facilities to incorporate this into their consultation room. This is now the bedding system that I know a few clinics have incorporated into their consultation room mat, because degenerative joint disease patients coming in, geriatric patients, patients that have been hit by cars or suffered some other type of blunt force trauma, and to be able to lie them on a nice supportive mat bedding system really is a game changer in how comfortable they are in any type of examination. I was going to say orthopedic examination, but just in a general practice examination, because we're now supporting those joints, those injuries, those areas that they may feel uncomfortable. They're more comfortable in the examination process. It's all about that multimodal approach: do no pain, do no harm. And I find that this would be a superior bedding system for that type of environment. So let's talk about out-of-clinic uses or in-home uses for this bedding system. And so I've broken it down into disease or treatment categories, and we're just going to go through these and then I'm going to explain them more in detail. So this system is really great for post-surgical recovery. Patients that are suffering from intervertebral disc disease. Patients that may have had a limb amputation or partial limb amputation. Injury recovery, so blunt force trauma, anything that happens to your pet that they don't need surgery to correct, but they've had some type of trauma. We know soft tissue trauma. Neurological conditions, degenerative joint disease, so osteoarthritis, or we could call this geriatric patients. Transportation, we're going to talk a lot of detail about how the system can be used in transportation and then as a multimodal life approach. So let's talk about post-surgical home recovery. And I break this down into two categories, orthopedic and soft tissue. So let's talk about how this bedding system can be used for orthopedic patients for home recovery. And your pet has just had orthopedic surgery. So when you think of orthopedic surgeries, you're thinking of broken bones, you're thinking of splints, plates, different hardware. It is a fundamental change to the architecture of that bony structure. And so we want to give them a bedding system that helps support them as they're recovering, because they're going to be recovering over weeks to months. This isn't something that they come home and they're up and running around the next day. No, they're going to be lying down and recovering. And it's really important that we have a bedding system that helps support them through this process, because they're mainly going to be lying on the other side than the surgical side. And so we want to prevent lesion formation, pressure necrosis, things like that would traditionally happen in a traditional foam or rug or mat bedding system. And so this system helps distribute that weight and gives them a more comfortable recovery process, because the name of the game is the less complications we can have early on, the greater the chance that your pet will have a full complication-free recovery. And this is also important for non-orthopedic or soft tissue surgeries as well. We want to recover them on a, once again, stable, soft, floating platform. So if they've been spayed, they've had exploratory surgery, they've had any numerous of the soft tissue surgeries as well, this is another system we want to think about, because usually soft tissue surgeries are elective. We know that they're coming on. Orthopedic surgeries sometimes can be due to trauma, and sometimes soft tissue surgeries as well. But mainly we know that they're going to have that surgery. So we can proactively purchase a system like this to incorporate into their home recovery system to make them more comfortable. But this is the gold standard in human hospitals. So why should it not be the standard in veterinary care, but also for our patients? Intervertebral disc disease. So with our intervertebral disc disease patients, either if they've had surgery or not surgery, this system I think is vitally important for their home recovery. Because we know when they're recovering from, let's use the examples, number one, surgical patients. They've had back surgery. They've been fused, there's been decompression surgery going on, we've opened up those facets between the spines, we've removed the cartilaginous fibrous disc, and that's usually the cause or the ruptured disc or slipped disc, and so they are at a surgical weakness and they have to recover because they've had major surgery. And we want a system that helps support them, because they're going to be lying in a sternum position or on their side, whatever we can do to make them comfortable while they recover. And as we said with the orthopedic surgery, now this is weeks to months for a full recovery. And so this system, I think, is almost mandatory, vital for any patient that's having intervertebral disc disease surgery, especially if it's in the cervical area. We don't want them thrashing around. We just want them lying there comfortable and not to get those pressure necrosis. And this should be the theme of everything I'm going to be talking about now with home recovery, is pressure sore necrosis, stopping the formation of that. Because once we get that coming in, we now have weeping sores, we have pressure necrosis, we have lesions that get infected, and it's really hard to get on top of that. And so if we can prevent that, we're keeping your pet more comfortable. They will lie there and they will recover. Because if they're uncomfortable, they want to move, and that can put jeopardy on the surgical sites to get a full recovery. And the name of the game is to have the least amount of negative side effects at the end to give them the best chance for full recovery. And this is also important when we use option number 2, non-surgical medical management option, we want to keep these guys pain-free and comfortable as well, because they're stiff, they're sore, they still have a slip disc in their neck, bulging disc, herniated disc, all these terms, it's still there. We're just giving them medical management to help with the inflammation. Bring that down, giving them the pain relief. Hopefully with that will decompress the pressure on their spine and they will get function again in their hind limbs. And so we need to do everything we can to protect that spinal cord, and that's where I see this bedding system is incredible in what this new technology can do to help keep our intervertebral disc disease patients comfortable, stable, but also give them the best chance of healing. But also I want to talk about another issue. When we have compression of the spinal cord, they may be incontinent. And this is a very easy system to change out if they urinate or defecate on the bedding system. We take the cover off, it's antimicrobial, it goes straight into the washing machine, we wash it, we put it back on, we wash the actual rubber cells with soapy water. It is a very easy system to keep clean and hygienic, and that's another reason I like it for these intervertebral disc disease patients. Amputation recovery, this is vitally important. This is also like the intervertebral disc disease. Really, it's a mandatory piece of equipment we should be using for our pets when they're recovering, both post-surgical, and I talk about it from day one of surgery, and usually it's three to 4 weeks, to long-term support. So let's talk about post-surgical example number one. They're coming home from post-surgery. Let's use as a forelimb amputation. This is a big deficit of material. They've lost their forelimb. There's a huge scar. It's moist. It's weeping. It is a horrific thing that will be the most horrific thing that you have to ever experience with your pet, and your pet will ever experience. And so they'll be lying on the other side once again, pressure necrosis. They're not moving. They don't know how to get up. This is they've got to relearn to walk. And so this system is an incredible supportive device to help manage their pain in the recovery period. Like with the intervertebral disc disease, they've got a weeping sore for either hind limb or forelimb, that there could be discharge, things like that will get on the bedding system. This system is really easy to take the cover off, wash it, put the cover back on, and keep it hygienic and sterile for them. And so this system is great for that, but also it supports them and their pressure points, but they're getting used to it and they're lying there. They're not going to be wanting to move. If they can get up into a sternum, they're now resting on their sternum and their rib cage up the middle, because they don't have, for forelimb amputation, they don't have the support of this limb to be out to steady them. So they're relearning, and we want to help and give them as much support as we can up the sternum. And the same for hind limb amputation. Then we've got to talk about long-term support. These guys now, as I say in our osteoarthritis program, the instant they lose a limb or a partial limb amputation, I like to tell my clients, think of your pet as 5 years older. And so let's use the example, they're 5 years old, they've been hit by a car. Now think of your pet as a 10-year-old pet in regards to degenerative joint disease. They're still 5 years old, everything else, but in degenerative joint disease, they're now overloading all those other joints in the body, because they're tri-limb now to help support their weight, distribute their weight. They're overloading those other joints. They're faster progressing in degenerative joint disease. So if we can help support those joints, help with blood supply getting to that area, getting rid of inflammation, as we've talked about previously, this is an incredible system at helping them with longevity in slowing down the development of degenerative joint disease. When we're talking about injury recovery, blunt force trauma, exercise, overexertion, and performance recovery. And we'll talk a little bit more about performance recovery we could in the transport area, but I want to touch on it here. When it comes to blunt force trauma, and this is soft tissue injury, and so we touched on this in the post-surgical recovery, but also this might not be surgical. They've fallen off the deck, they've run into something, you've actually kicked them, something's kicked them like a horse, anything that causes soft tissue trauma. This is a great system, once again, for the support that it gives. It increases blood supply to the area. It helps with getting rid of inflammation, the lymph, helps with stimulating, as I said, the blood nutrients going to that area to help with getting and healing the soft tissue injury. They may not want to be getting up, so they may be lying on their side for a while. And traditionally, hard foam beds are really uncomfortable for them. So I really like this system for blunt force trauma. This is also a great technology to be incorporated into cages for sporting and competition dogs. And so when you think you've gone for a run, think of doing exercise yourself. You're sore, you're hurting, you may be injured or not. Having a supportive structure in your car, in your pet's crate, your competition dog's crate, to help give them support after competition really is another way we should be thinking about incorporating multimodal approaches into protecting our competition and working dogs' joints to help them recover. Increase more blood supply to the area, get rid of the swelling and the edema from overuse. Also to help them with traveling. But now on the return journey, we are giving them a system that helps protecting their joint or protect their joint after they've been the athlete and worked to their full potential. They're now going to be fatigued, lactic acid, sore if they've done agility, going over hurdles, through the weaves, up and down the A-frames. They could be sore, especially with our aging competitors. And this is just another way to help them recover on that drive home, because now they're back in a crate for 3 to 4 hours, back potentially without much support. That secondary inflammation from point necrosis, they're going to get out stiff and sore. And this is potentially where we can develop secondary injuries. And this system helps prevent that. So with exercise exertion, much like with blunt force trauma, how this system works at moving, distributing weight when they're lying on it, bringing blood supply to that area, getting nutrients there, getting rid of the lactic acid, all the edema that we know when we go and we go to the gym and we pump iron and we build that lactic acid up and we feel sore. It helps with that when we run and we're doing activities. And this is important in our sporting dogs or working dogs. So exercise, exertion, they're out there, they're doing their activity. They've done, let's use an agility dog as an example. It's done its trial. We put it back into the cage. It is now lying on the bed. It's moving, it's supported. It's not lying on a hard surface. It's not getting that lactic acid bruising when it's lying on a hard surface. We're supporting it. We're helping with the exercise exertion. Working dogs, military dogs, police dogs. When they are in the car, we're actually helping them balance. They're not being bashed around. They're being on a supportive bedding device that's helping keeping them warm, help keeping the lumbar so they're being warmed up. So with the exercise exertion, they can do those explosive exercises, come back and they're warm and they're ready. They're not lying on the hard floor and building, getting cold, cooling down. This helps keep the muscle going, keeping them warmed up. And then with performance recovery, this is after they've done their job, after competition, after you've been on that big run with your backyard hero pet, after the working dog has done its shift work or finished for the night on patrols. The recovery is really important. And so this type of system, because we know, let's use the agility jog as well. They've done their time trial. They're put straight back into a cage. They don't have a way to cool down. If we're not cooling them down, then they're on a bedding system that will help with the recovery, help with the blood flow, help with getting that lactic acid. I see too many competition dogs, it's just thrown straight into the metal crate cages. It's a hard floor. There may be a towel if they're really lucky, and a bowl and that water if they're even luckier, but they're put in there and they sit there or they lie down. They're lying on that hard surface, and this is not about performance recovery. It's all about, these are exquisite athletes, highly trained. We want to do everything we can to help them with their performance. I used to go with Dr. Jamie Gaynor to agility events with a 20-foot trailer and a sense mat that we could run the dogs up and down, and would tell where they're lame. We would laser them before they went into the competition rink. We'd find out where they were sore. We would laser them and they would run pain-free. It's all about your time and effort that you've invested into your pet to be the elite athlete they are. This is another piece of equipment that helps with their performance, to keep them up there and help the formation or prevent the formation of injuries. And so this is another piece of technology we should be incorporating into our performance dog regimes to help them recover. And this goes for our working dogs, our police dogs. Once again, there it's in the back of the squad car, the back of the military, in their kennels. They have this supportive device. They're not, once again, on concrete floors or hard floors. They're being supported, because if we can prevent the soft tissue injuries or just the lactic acid buildup, we know we go for a run for that first time, we hurt. If we had this system, this helps the prevention of lactic acid buildup. We're maximizing the performance of our athletes, and we're giving them longevity to their life of performance or work. With neurological conditions, this is a system that really works at protecting your pet. If we use seizures as a good example of this, they're thrashing. If we've ever seen a grand mal seizure, they thrash around. If they're on a hardwood floor, I usually wrap them up in a blanket and I put them onto my bed, because I've had a pet that's had seizures before, just to get them onto a safe environment. It's like humans. We always want to move them away from where they could hit their arms, bash their heads where they're having a seizure. Get them in a safe environment. This is the same principles we should be thinking about with our pets if they have a history of seizures. Putting them in a safe environment, that they're now on this air mattress, they're floating, they can't thrash around, getting the neck size up so you have plenty of room for them to roll or thrash around, and they're not going to hit or hurt themselves. With degenerative myopathy patients, and this is a topic that's really close to my heart, because this is one of the reasons I got into rehabilitative medicine, was my wife's dog Tova. And Tova was a Malinois, and she developed degenerative myopathy 20 years ago, and we didn't know what to do. And we were both veterinarians, and the learning curve to try and learn what to do 20 years ago made me want to learn about sports medicine so I could instruct my clients so they never felt lost or left out or confused about what to do. And so the bedding system is the number one thing when it comes to neurological patients, but also degenerative myopathy, because they don't know that they're losing the ability to feel their hind limbs. It's a slow progression over 6 months, but they will start to progress. And we want to support, because as they start to lose neurological function of their hind limbs because of the axons in their spinal cord are starting to die, they're losing muscle mass around those joints, the hip joints, the stifle joints. They're becoming anorexic in that area. And so those joints are then susceptible to bashing and necrosis. And so by having a bedding system like this, keeps them comfortable, keeps those joints supported, and prevents the formation of lesions and point focal necrosis lesions. And once they start, they're really hard to get on top of, because they continually damage them, but they don't feel them. And so this is really the stay or hallmark of any neurological patient when it comes to degenerative myopathy. This bedding system, I think, is a game changer. I wish it was around 20 years ago when we had Tova. And so also, as we've talked about, the antimicrobial denim-like micro-suede material can be washed really easily, because they will become incontinence, both urinary and defecatory as well. And to be able to slip the cover off, put in the washing machine while they're still lying on the rubber mat, so they're still getting supported while we do a quick spin cycle, wash it, dry it on a low heat in the dryer, and put it back within half an hour, really is a game changer for the medical management of these neurological patients. And this comes into paraplegic patients as well. What I've talked about with the degenerative myelopathy patients also applies to paraplegic patients, but they're paralyzed from day one. They now have no muscle, no movement, no muscle mass. Their limbs are susceptible to trauma, their joints to rubbing wear, more so for the lesion formation because they can't feel anything. And these are the guys that we need to protect. And this system is an incredible system for doing that. Traditionally, we would use a memory foam system in the clinic to bring our neurological patients in, lie them down for treatment. But clients couldn't purchase that at home. This is a system that you can purchase at home that does that and more, because that was just thick foam that was really soft and gooey, but it didn't move. This moves, and you couldn't pull the cover off. It was a rubber cover to clean. And this system gives you the benefits of that, plus 6 degrees of movement, plus the ability to take the cover off if they have an accident, launder it, and then put it straight back on. But this is my go-to system now for any neurological patient, either having seizures, DM, or being paraplegic. This allows them to have a system that they can come along with you. You can put it down in your office or the bedroom, and they can lie on the bed, be happy, and you know that they're being supported. Their joints are being supported, and we're not getting lesion formation. And then we come to my favorite degenerative joint disease. And so this bedding system really should be called a life-changing system. We talked about that back earlier about philosophy of use. And the philosophy of use for this bedding system in the prevention and slowdown of degenerative joint disease is quite amazing. Just we'll look at force place analysis, how you no longer have the loading of the elbows because dogs like to sit sternal, and you now have no loading. So if they have elbow dysplasia, we're supporting those joints. Blood supply is getting in. We're helping with inflammation. We're slowing down the progression of degenerative joint disease. This is a lifestyle bed. This is a long-term treatment option. Not, as I said, we shouldn't be thinking about this as they get older. We should be putting the puppy on this bed all the way through their life to give them the best chance possible. And really, this should be called not, I'm going to say geriatric medicine, but life medicine. But we need to start, if we have a geriatric pet, we need to get them on one of these bedding systems straight away. And then we need to think as we go through back date, all the way down to puppies, getting puppies on them early on, because this is a great system when it comes to degenerative joint disease to make them more comfortable. The more comfortable they are, the happier they are, the better quality of life they have. So transportation, this comes back to really a philosophy of use. How you're moving your pet around in your vehicle. What are the different time components of moving your pet? But I break transport down into 3 areas: trip, travel, or journey. And so to me, a trip is less than 1 hour. Travel is 1 to 4 hours, and then journey is greater than 4 hours. So most of 80% of pets out there very rarely go on a travel. They're mainly trips, so less than 1 hour. So you might just have your pet is a backyard warrior. They only get in the car to go be to the vet. So that may be to the park, or that may be to the beach or an area. And this is a great system just to have in the back of your car to help your pet when they're moving. And so if your pet is a senior and this helps them move, they can then sit in a sternal position and just gives them support when you're driving and going around corners so they can balance more effectively in the back of your vehicle. And so this system, it fits perfectly into the back of a 4-wheel drive, as these photos show. You're traveling, you may be going to on holidays, but very rarely do you go more than 4 hours. Journeys are there for really the competition or the elite athletes or working dogs that then people are traveling all over the countryside to take their pets to competitions. And this is really journeys greater than 4 hours. And this is where the bedding system really comes into its own to help protect them on those long journeys, because traditionally you're driving for hours to go to competition, or to working events or sporting events, and your pet is traditionally in a hard crate. Let's think of those plastic travel containers. They're traditionally on a hard floor, bashing around, rolling around, their joints are being compressed. They're potentially getting secondary inflammation. If we can incorporate a system like this into the floor of their crate, their cage, or the back of your SUV, or the back seat of your sedan, we're now offering more joint protection as they're going to the vet. They're going to arrive refreshed, pain-free from any potential secondary inflammation or trauma while you've been getting there. That will mean they will perform fresher. They'll perform better and pain-free, and that is what it's all about. So let's talk about bed size guide. Now this is very important, choosing the right size mat for your pet. And so the bedding system comes in 5 different sizes: extra small, small, medium large, and extra large. And so the extra small bed is designed for a cat or a small toy breed dog. Now also some exciting news about the extra small bed. It's getting an upgrade. And so talking to the manufacturers, they said they're bringing out a new size bed shortly that won't be 18 by 18 inches. It'll be 18 by 20 inches. So that should be coming shortly, but that's also another bit of exciting news about the extra small bed. The small bed is designed for multiple cats or multiple toy breed size dog or a small dog. And this size fits perfectly into most crates and small pet transport cages. The medium-sized bed, this is for medium to large breed dogs or multiple small dogs. This size bed actually fits perfectly into the back of a SUV, but this size bed, as the photos show, fits perfectly into the back of a 4-wheel drive or SUV. Now the large size bed is for a large breed dog, and so or multiple medium dogs or multiple small dogs, so everything works in multiples as you're going up, or it's for one large breed dog. And this bed works great for the back seat of a standard car or SUV. So if you're transporting and your pets like to sit on the back seat, this is a great size bed because it covers pretty much the entire length of the back seat and gives them really good support. And then we have the extra large bed, and this is designed for giant breeds. And so this bed is a great system as it gives the length and then the width so that most giant breed dogs can lie down on it. It is a great full covering to have multiples of these around the house. If you have multiple medium to large breed dogs, would also be a great alternative to multiple small beds around the house. So this is really important. This is, I call, the rule of thumb when it comes to sizing. We want to go bigger. We want to upsize. So if your pet is in between a certain size, always go the bed bigger for them. If it's not for a specific purpose, like being in the back of a trunk of a car or being on the back seat, always upsize the bed, because you can see here on the left hand side, here's my German Shepherd on the medium sized bed, and you can see he's pretty much covering the whole bed. But then when you look at the large size bed on the right hand side, you can see it is a much better fit for him and his size. Because it's really important, if you have multiple dogs in the house as well, that then you'll have multiple animals on the bed, and it can get quite crowded. Because as you can see here, when you have multiple pets, and this is the medium-sized bed, that can get quite crowded when you now have 2 pets, or even if you have 3 animals on the bed, because we all love this system, everyone fought to get on the bed. Always think about upsizing, especially if you have multiple pets in the house. Pricing. Because this bedding system isn't a cheap bedding system. It ranges anywhere from $150 to $400 for the extra large bedding system from the extra small bedding system. So if you have a medium to large size dog, you're looking to spend anywhere from $300 to $350 for a medium or large bed. And you might think this is crazy, but when you compare that every 6 to 12 months you're purchasing a new bed or one of those foam beds from a traditional box retailer, and you're spending anywhere from $40 to $70 every, say, year, then in 3 years you've spent more than what this bed costs that lasts a lifetime. Plus you're giving your pet the support of its joints and protecting those joints to slow down the development of degenerative joint disease. And when you take that all into consideration, this is a pretty cheap bedding system for what you get. The technology that has gone into this and the development is quite amazing. And what this can do for your pet is going to change their lives, especially if you have a competition or a sporting or working dog. Being able to put this system into their cages or crates for the transport to or from, have them lying on this system while you're waiting to compete or working, really is going to change how your pet performs. So if we look at a traditional bed from a big box store, what we traditionally think of as a dog bed, this is a great example. And so this is a bed that I picked up about 6 months ago from a traditional box store. And you pay anywhere between $30 to $70 for potentially one of these luxury plush beds. But we're now 6 months in. And if we look at this bed, we already see the concaving out here of what is called the memory foam. But I never knew about bedding materials before I encountered this new bedding system. So I thought memory foam, it's going to be like a traditional memory foam bed for us humans. They're going to get all the support they need, but it is not the case. Because when we have a look inside, and I unzip, we see that it's just a filled of foam. So we have bits of foam, and this foam then compresses. There's no substance to it, and it compresses. So what we're thinking we're doing a good job, what we're paying for, what we think we're getting is not the case. And so over time this compresses down, and now the joints of our pet are now in direct contact with the hard floor, and that's not what we want. Now that we have the Underdog Therapeutic Bed back, and we can compare it to what we just saw that was a traditional foam mattress bed that we all buy from the big box stores, we can see the difference when it comes to the dry flotation technology. And as we look inside, now when we compare it to what was that foam, and there's still pieces of foam here on the floor, we now have this cushioning technology that now is supporting our pet. It is no longer going to break down. It's not going to compress. We now have, for the life of this bed, we have that air flotation ability to protect the joints. And this is what's the fundamental part of what makes this bedding system so unique, and why I'm so excited about it for what it can do for especially my geriatric patients. Because now their joints are protected. We can see as we push down, it moves. We have joint protection, and no longer their joints are pressing down on the floor. So we now have complete joint protection, and this translates through to comfort for our pets. So as we've been going through this review, I think you might have been picking up that I'm pretty pleased with this product. Actually, I'm ecstatic with this product because it has exceeded all my expectations. When they first sent me the bed, I went, wow, this really is going to be a game changer in the industry, but also a game changer for multimodal practices to prevent and slow down the development of degenerative joint disease. And this really is new technology that hasn't been out there in the veterinary profession. It has been in the human profession for decades, but now it has made its way finally into the veterinary profession, and it is a game changer. So if you want to learn more about this bed, the Underdog Orthopedic Bed system, go to our store at Canine Rehab On Demand, click bedding systems and you'll find it there. And we're really excited to have them in the store because I only want to have quality products in our store that I know work and will make a difference to your pet's life and your life. And so I really encourage you to go check out this product, and this is the review of the month.